This video provides information from the internet, and we do not promote any products or medicines. Always consult a doctor before using any medication. We are not responsible for any side effects or issues resulting from self-medication.
Pentoxon M Capsule is a medication used to manage nerve pain. It combines gabapentin and methylcobalamin to provide effective relief. Indications and uses. This medication is primarily used for the management of nerve pain, particularly in conditions such as diabetic neuropathy and other nerve-related disorders. It is known to alleviate pain sensations caused by damaged nerves and is often prescribed as part of a comprehensive treatment plan for patients experiencing chronic pain. How it works. The combination of gabapentin and methylcobalamin works synergistically to reduce pain sensation and repair damaged nerve cells, ultimately improving the patient's quality of life. Directions for use. Patients should take this medication as advised by their healthcare provider. It can be taken either with or without food. It is essential to swallow the capsule whole with a glass of water and not to crush or chew it. The physician will determine the appropriate dosage based on the patient's specific health conditions, age, and body weight. Abrupt discontinuation of the medication without consulting a doctor is discouraged to avoid withdrawal symptoms. Possible side effects. Potential side effects may include dizziness, drowsiness, nausea, and increased emotional variability. If any side effects are troubling or severe, it is crucial to contact a healthcare professional. Precautions and warnings. Patients should inform their doctor of any pre-existing conditions, including heart, kidney, or liver issues, before starting this medication. It is not recommended for use in pregnant or breastfeeding women unless absolutely necessary. Caution is advised when driving or operating machinery due to possible drowsiness. FAQs. 1. How long will it take for this medication to start working? It may begin to show effects within 2 to 4 weeks. 2. Can it help with diabetic neuropathy? Yes, it is effective for managing pain from diabetic neuropathy. 3. What if I forget a dose? Take it as soon as you remember, but skip it if it's near the time for your next dose. 4. Is it safe to take with alcohol? No, alcohol should be avoided as it may increase drowsiness. Thank you for watching. If you have any questions or suggestions, feel free to leave a comment below. Your feedback is greatly appreciated.